On the playground, Colvin Wong of Burnaby is like any other 8-year-old boy. And he seemed like any other normal baby at first.
Once he reached 1 year old, we kind of thought, he's not speaking yet. And we had our suspicions. We kind of thought, okay, no big deal. He seems healthy, seems happy, until our second one came. And that's when we kind of knew that, or we had a feeling that there was something wrong.
The Wong's second son, Cade, responded to noises, but Colvin did not. So he was tested at BC Children's Hospital.
I knew it was bad news. I knew it was going to be bad news, but I just cried. I was sad.
Colvin was deaf. At the age of 2.5, he had never heard a sound. His parents didn't know if he would ever be able to hear or speak.
Now, the critical time for acquisition of language is in those first few years. And if you don't identify a hearing loss until a child is 3, they have missed a huge amount of input. And they, in many, many instances, don't catch up.
Colvin was a candidate for a cochlear implant. This is an electronic device that picks up sounds and transmits them to a receiver implanted behind the ear. The sounds are then sent as electric impulses to the hearing nerves in the inner ear, and the brain can then perceive them as sounds. This device can be an option for patients with severe to profound hearing loss. Dr. Kozak performed the cochlear implant surgery, and after a month of recovery, Colvin returned to Children's Hospital to have the implant activated.
And when they did switch it on, he was kind of shocked by the sound, and he would cover his ear and tell us that he hears something, but with a confused look, like, what kind of sound is this?
Colvin then had to learn to listen and develop spoken language. And with the help of constant therapy, he very slowly began making sounds and then words.
I have some dress-up clothes upstairs, said Miss Gray. Would you like...
6 years after the implant, Colvin's progress is remarkable. He's doing well in a regular classroom at school.
Colvin, should we do this? Are you ready?
Yes.
And Colvin's achievements go beyond spoken language, though he's still learning how to interpret complex sounds such as music.
He can play music. I mean, who would have thought that? Really, again, technically speaking, he's deaf. He can play music.
Okay, Colvin. Remember, when you hear the soft sound, press the button, okay?
I'm 8 years old.
Good.
The cochlear implant team at Children's Hospital monitors Colvin's progress. They also do about 30 implant surgeries each year, giving children who get limited benefit from hearing aids to have a chance to hear.
This is probably one of the most satisfying operations that I do for my patients. When you see the fruits of your labor 3, 4, 5, 10, 15 years down the line, it's a wonderful thing.
Children's Hospital gave Colvin a chance to be like any other normal little boy.
And that's because the fact that he was given that gift from Children's Hospital.